Welcome back. This segment is brought to you by the Center for Plastic Surgery in downtown Grand Rapids. Whether you need a mommy makeover or you're just looking to improve your shape, breast augmentation is a popular option for many women. Dr. Ben Reckner is here to talk with us more about it, and be advised, some of the photos you're about to see may be considered somewhat graphic. It's good to have you here.
Well, thanks for having me.
A lot of people making this choice, maybe they've waited a lifetime to make some changes, or changes in their body later in life have required it.
Yes, there are two kinds of women that really think about augmentation usually. There's the younger woman who may not have a lot of volume and wants to have more volume, and then there's the other type of woman who maybe is a little bit older, who's had children and has lost that breast volume and wants to restore it.
We've got some graphics to show, in fact, exactly what he's talking about. And first, we're going to start with that younger woman who perhaps, all her lifetime has wished for more.
Right, it can be a real sense of her femininity, and she may identify with her femininity that way through her chest, and you can see in the graphic that there's really not any volume there, and then after she has an augmentation, it really restores that, or gives her that volume that she's always wanted.
Okay, and then we will show you the loss of volume that can happen with childbirth and simply with aging.
Right, and gravity really can wreak havoc on all of our bodies, and you can see on the picture on the left there, there's the loss of that upper pole volume there, and it kind of slopes in, and that's restored in the photo on the right after the augmentation. So,
for a woman who is considering something like this, there are many decisions to make. First of all, finding a surgeon, and then many more. Silicone, which products do we use? How does a woman work through all these questions?
Right. A woman obviously has to come to a point where she really wants to have the surgery done for her, and she chooses the surgeon who's board certified and experienced, or someone who's board eligible, and then find someone that she's really comfortable with in an office that she's comfortable with, and then the decision to have the surgery comes about in terms of what type. Do you want a silicone one or a saline implant? And I think the silicone implants are a very nice device. They were approved by the FDA in November of 2006, and it really gives a nice natural result, and I think a lot of women are choosing that option now. Because
there were all these concerns about saline implants. Are all of those resolved? I mean, is there a safety issue still?
I don't think there's, well, the FDA has approved them, and it's probably the most studied medical device, I'm sure there are some women who are not candidates, people that have autoimmune issues, people with lupus and MS and those kinds of things. A foreign body can trigger a flare-up of that condition, and so those people are not advised to have the implants placed. But the silicone implants are safe.
Can women still breastfeed after this procedure?
So there's a certain percentage of women who can't breastfeed naturally, whether they have an implant or not, but most women who do have the implant can still breastfeed afterwards.
Mammography is still possible? You can still identify problems in the breast, the remaining tissue and such?
Yes, and there are certain techniques that the radiology techs will use to maximize their views and still get very nice results in terms of the mammograms.
What kind of a setting can women expect in terms of going in to have this procedure done? This has kind of become a more common, relaxed approach, isn't it?
To some extent. In terms of the surgical setting, it's usually done as an outpatient operation.
It's unbelievable.
And it should be done in an accredited center. Some people do it at an outpatient surgical center, and with a board-certified anesthesiologist and an experienced surgeon. And the setting is what you'd expect in a medical environment.
Of course. All right. Well, we want to let folks know that you can find information on the Center for Plastic Surgery on our website at WZZM13.com. Just click on Take 5 links. Lots more information there. Doctor, thank you for being here.
Thanks for having me.
When we come back, we're going to share some skin